Hi, I'm Luke O'Neill, and here I am in my lab in the Trinity Biomedical Sciences Institute. So in this week's COVID-19 update, a big fluidics conference was held in America discussing how we get better sort of ventilation into rooms. It discussed droplets, aerosols. Thousands of scientists gathered to discuss how we best mitigate against COVID-19. Some very interesting findings. First of all, they looked at musical instruments, and if you play them, how much do they transmit the virus? Flutes, it turns out, are pretty safe. Oboes are not, and clarinets, they get quite damp and then lots of droplets come out of them, and you can stop the spread by putting a little mask on the bell of those instruments, and they discuss which instruments can be played safely. They also have an app, a very interesting app that you can use, and you can input all your data, the size of your room, number of people, so people can download that app now and decide how much ventilation is safe in a given room. And of course this week more numbers from America, and as we all know now the numbers are growing there. 50 states now are showing growth in cases, and it's worrying people. Tennessee, Virginia, Texas are now all overwhelmed. I mean, it's a ridiculous scenario in many ways. Those states are bringing in extra medical personnel because so many are getting sick. The big fear is this will continue to grow in the coming weeks, and of course America now must start mitigating against this virus as so many countries have. So a big fear now that America will see a real upsurge in cases and in deaths. And of course, as we know this week, a third vaccine, AstraZeneca, was reported on. Again, 90% efficacy in a subgroup in that trial. Now, AstraZeneca are very interested in getting the vaccine out to low-income countries and middle-income countries. They're allocating 1 billion doses of the vaccine for those countries. It's very important to vaccinate in those countries because, first of all, they're more vulnerable. Poverty always is a huge issue when it comes to pandemics and people suffer. Secondly, the virus could well persist. There's no point in vaccinating in, say, America or Europe unless we're protecting those countries as well. And the organisation that coordinates this is called COVAX, with CEPI, the other organisation, and they've got billions of dollars deployed now to make sure these new vaccines go to the countries that need them most. So you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstalk.